My name is Dr. Howard Freeman and I'm privileged to be the chair of NHS Merton CCG. Merton CCG took over the commissioning and the planning of most health services for the 200,000 plus Merton residents on the 1st of April 2013.
I think it's really important that clinicians are involved in the heart of the CCG. By seeing patients day in, day out and then being involved with the CCG, I can help give my input on behalf of my patients to make things better.
The budget for Merton CCG is £207 million and we use that to purchase the most effective and efficient services that we can on behalf of our patients. And of course we do have to make sure that that balances at the end of the year.
Since the inception of the CCG, the 25 practices in Merton are being grouped into 3 localities, West Merton, East Merton and Rains Park. So for example, in my locality of 8 practices, we meet on a monthly basis and there's a great opportunity for us to look at what are the issues and looking at ways to make things better for patients, and it works very, very well.
The commissioning team work with myself and the local population to assess the needs that the population have in relation to their healthcare. We then look at the solutions that we can put in place for those particular needs and then commission care from local providers. Our local providers will be our acute care services, our community care services and the mental health trust.
We're very committed to bringing patients and carers in at an early stage in the development of services, and we're very pleased that we've got a good working relationship and have involved Health Watch Merton, the Health and Wellbeing Board in Merton and community groups in order to help us move forward with our service design.
Patients are the people who use the services, so really to take their opinions and their experiences into consideration when you're planning and recommissioning services for the future, then ultimately their information is going to help you make them better for the people who use them. Health Watch Merton have been really pleased to see how the clinical commissioning group have been taking patient engagement really seriously, and we're just looking forward in future to seeing how that has real impact.
Patients and GPs told us they wanted better enhanced community services to prevent admissions to hospital wherever possible. We worked closely with our colleagues at Sutton and Merton Community Services, who are part of the Royal Marsden Foundation Trust, and jointly with them we put together the Community Prevention of Admission team, our CPAT team. That has had a huge impact in reducing admissions in its first year of operation.
The Community Prevention of Admissions team is responsible for taking referrals from GPs or other referrers to see patients either in their own home or in a nursing home who they feel might need to be admitted into hospital. We visit those patients and assess them and put into place other care that might help them to stay in their own home. The team consists primarily of nurses, but we also work with occupational therapists and physiotherapists if the patient requires that care. Well, patients have often reported to us that they feel sometimes the need to call an ambulance, but when we go in to see them, they feel more confident.
The achievement I would like to talk about is the work that we've been doing on end-of-life care. Up to 70% of our patients who are in the final days of their lives have recently been able to achieve their preferred place of care, and it's mostly in a non-hospital setting.
The investment in 3 nurses who support the end-of-life care agenda by visiting practices and care homes has been useful because they are able to train and support staff discussing difficult issues about how people are supported in the final days of their lives.
The Nelson Health Centre is scheduled to open in spring 2015 and it'll be a fantastic resource for the residents of Merton. There are lots of different facilities for patients within the building. 2 GP surgeries are moving into it. There'll be diagnostics, including X-ray and ultrasound, blood tests, a pharmacy, outpatients, minor ops facilities. And for all the patients of Merton, it will be a resource that can provide lots of the care that is currently provided within hospitals, so they won't have to travel a long distance. And also the opening hours will reflect our wish to increase accessibility. It'll be open early mornings, evenings and on Saturday mornings.
Just as excitingly, we've begun the engagement process with local residents about the second community hospital in Mitcham. We need to finalise the site for that, but we hope to move forward with that just as rapidly in the next year.
At the end of year one, we've managed to put in a number of different solutions for the population of Merton that we're really proud of. One of those is our 111 and out of hours service, a service where we can ensure that people are accessing care at the right place and the right time. On reviewing that service, it is going really well, and our patient feedback is that they are really finding that to be a really helpful solution for them in Merton. We're also really proud of our Dementia Hub. The Dementia Hub offers people with dementia ready access for early diagnosis. It also offers a facility for people who care for those with dementia and their families so that they can have access to education to help manage that condition in the most proactive way.
I'm extremely pleased at what we've achieved in year one. I think it's not been an easy task to set up something from scratch, and I'm delighted with the clinical involvement that we've had and the stakeholder involvement of the local authority and users and carers, and particularly the staff of Merton CCG who've worked so hard to get us to where we are now.
I hope we've shown you all of the progress we have made in Merton CCG in our first year. It's been a really positive start for a new organisation, and we believe we are already improving healthcare for Merton residents. We want to continue that progress in our second year. We want to ensure that every Merton resident receives the best possible healthcare.